It's a beautiful day in Madison, and I hope you get out to enjoy a little bit of it. For this next hour, I'm going to talk about something that I think should be of general interest to anyone in an academic medical center. I often talk about esophageal surgery, esophageal cancer, and as we get more and more specialized, the interest level in that topic gets narrower and narrower, and you find you're talking to a bunch of glazed eyes and sleepy heads. And while we all know something about writing, I think every day I learn something more about writing. And again, it's a little bit like bringing coals to Newcastle as the site of the editorial office of the Annals of Surgery for many years, but Bing is one of my mentors, has influenced my writing as well as he has many of you, and you have such an able leader now in Craig to carry on. The University of Oregon School of Medicine, a little promo has to be done. It's the second oldest medical school west of the Mississippi. It started in 1887 in a little house in the northwest portion of Portland. And Professor Mackenzie, who was the namesake of my professorship, my chair, was a railroad surgeon from Canada, and he had access to some railroad land, which was purchased for a roundhouse on a plat, without understanding that it was on the top of a 500-foot hill. So not very valuable to the railroad. It became the site of the University of Oregon School of Medicine. This is Mackenzie Hall that you see here where my office still sits. This was the picture of Mackenzie Hall as the last tree in Oregon was felled in which someone wasn't sitting in it. This was done at the time of the building of our new library that was now, of course, very old. And this is what OHSU looked like when I arrived. Pretty much occupied the whole hilltop with the Willamette River off in the distance, Oregon wine country just up the river. We had outgrown our hilltop, and so the next move was to build a campus on the river, right on the shores of the Willamette River in an old industrial area, and trying to figure out how to connect that to our new building on the top of the on top of the hill was quite a challenge, and this became the answer. So we're, I think, the only academic medical campus with a ski lift right on it, but very rarely do we actually have enough snow to ski down, but it has been a good transportation link. So in any event, what I'm going to talk about is writing. I'm talking about different levels of it, so that there's hopefully something for a medical student as well as something for a seasoned professor here. My qualifications to give such a talk started as an English literature and language major in college, and then working first under Frank Moody, Bing Rickers, and a great cadre of academic surgeons at Utah, became very interested in writing about what we were doing. So abstracts, papers, book chapters, a few books, and then I've been editing the World Journal of Surgery now for the last 6 years. And you're often taught about the three-legged stool of academic surgery: healing, teaching, and discovery. But really, it's a four-legged stool, because should you not be able to write about it, you're probably not going to get promoted. So writing is really important. And in fact, Ted Truss, who's at Dartmouth now, was a fellow, and said at the end of his fellowship, "I learned a little surgery from you, but I sure learned how to write." Because I think this is a sort of a deficiency in so many people coming into medical school. So why is this important? Well, it's important because your academic prowess is measured, as Craig introduced me. He introduced me by the number of papers I'd published. It's measured by the number of articles published. Publication deficiency is the greatest single barrier to promotion. As a chair, we review lots of CVs, and there are phenomenal surgeons who will never become a professor of surgery because they just don't have enough publications. It drives many bright people away from academics, and it's not easy for anyone. I think that those who believe that someone like me can just sit down and write is just not true. I mean, some of the best novelists were really tortured by their writing. Even F. Scott Fitzgerald needs a Malcolm Perkins, so everybody needs an editor. So you need to have writing skills, and you need to find an editor. Editorial misconduct, perceived or real, destroys reputations. And so you need to be very wary of this, and I will talk some about that. So what I'm going to do here is talk about formulating the right question, how to overcome writer's block, talk about some of the elements of a paper, some of the authorship requirements and how you navigate those difficult waters, some publication rules and traps, how to survive peer review, and lastly, and finish with writing a good review, because I don't think anybody ever teaches you how to write a review. You're just given a manuscript and said review it and send it in. What we won't cover today is grant writing. That's a whole different art. CV writing, a different talent. Letter writing, and the great American novel. Not today. So formulating the right question is really probably one of the most important things you can do. I can't tell you how many times I get papers that are beautifully written but just aren't interesting. There's no controversy, no innovation, no nothing there. Atul Gawande has made his whole career and made his fame focusing on common problems, retained surgical items, deaths in hospitals. Focus on common problems, and you'll develop and do it very well, and you'll get a long distance. Before you plunge into collecting data, see if the data is already there. There's a ton of data out there in population-based data sets, existing literature, and even in your own institution there may be databases you're not aware of that you can tap into. So look around, really comb the institution, talk to your public health people, see what data already exist. And if not, then you need to start from scratch and pulling the data together. The study design, I think there are three elements that are critical. Make sure you have a firm hypothesis or aims in mind before you get started. Has it something new to offer? Again, that innovation. Is the question answerable? And if it's a philosophical question such as why is the sky blue, you're not going to be able to answer that one. Is it ethical? Again, very important. And right off the bat, obtain statistical consultation. I can't tell you how many people go through a study and then come back later and pick up the statistician. Don't do that, because you'll find that there'll be difficulties with your data set most frequently. Power analysis is critical to any prospective study, and is it feasible with the population that you have at hand? If you have a small population, you can't do a large study. And most importantly, especially from the chair's perspective, is there adequate funding to do the work? Don't get halfway down the road and run out of money. So don't do Me Too studies, the most elegant papers that don't add anything new. When you have your 25th retrospective trial of laparoscopic appendectomy in the pediatric population, it's not going to add much to the first 19 unless it's about twice the size. Certainly there is room for more than one randomized trial. Just because there's one doesn't mean you have to stop there, but after there are about 12 or 13 that show the same thing, probably don't need to do another one. Don't report interesting findings with no clinical or scientific relevance. So just because you find something interesting doesn't mean anybody else is going to. Use current scientific techniques. I think that goes without saying. And I would urge you not to waste time with case reports. Again, I always get some debate about that. Well, it was a really good case, and I really need to get it in the literature because there isn't any in the literature. But journals just have a limited number of pages, and our journal, Annals, most of the good journals don't even accept case reports because there's no room for them. So the next sort of theme here is writer's block and how you overcome it. Getting started is clearly the hardest part for most people. And there's really no shame in resorting to crutches. My crutch is a dictaphone, and I was behind on a book chapter. I was behind on writing the minimally invasive surgery chapter for Schwartz. And I was driving from the American Surgical in Quebec City down to see my parents in Hanover. So I picked up a dictaphone, and I dictated that chapter in the 4-hour drive from Canada to the U.S. and got it done. And so a dictaphone is a very helpful way for me. There are other crutches that people use. Modular writing is helpful for many. Don't necessarily start with the introduction. Start with the discussion. Start with the results. Start with the methods. Start with a different section that you know well, and then work backwards. And deadlines really are a must for almost everyone. I don't know many that can write without them. Find an environment with no distraction. Again, long drives has worked for me. Walking around is another good way to do it with again, with a dictaphone in hand, or find a motel room or a borrowed beach house or a cabin on a lake and just go right there with no distractions. If you can't do that, if you can't get away, then try to eliminate as many distractions as possible. Again, hard to control. So moving on to the paper itself, the abstract. The abstract is really the key, especially for writing for a meeting, but even just for writing for a manuscript. You really need to know how to write an abstract. And language precision is absolutely key. And if you don't remember Strunk and White from college, you should. The first word in Strunk and White is avoid needless words. Avoid needless abbreviations. You get bogged down in abstracts when you have 14 different abbreviations in there. The first draft, don't worry about word counts. Just write it. And most first drafts are 400 words or more. Easy to get 400 words down to 250 words because about half of those words are needless, and you can eliminate them easily. After reading the abstract, there should be no surprises in the article. So most people don't read articles anymore. They just read abstracts. They don't have time to read the article. So when they're done reading your abstract, they should know everything that you're going to put in the article itself. No surprises. Should be structured. The required elements are at a minimum an introduction or background, and the aim of your study goes in that section. Methods, results, and then a conclusion or discussion paragraph. And then certain journals require other elements, including the study type, the setting, and etc. Tables and graphs are okay for Congress submission, but not very valuable or not something you'd put in a abstract of a manuscript. How long should your work be? Again, these are just rules of thumb from a journal editor, but abstracts are generally 250 words or less. Review articles should be 3,500 words or less, with probably 100 references or less. Original scientific presentations should be a little shorter and with fewer references. Brief technical reports, about 1,500. Editorials, 1,000 or thereabouts. Commentaries, order of 500 to 1,000 words. And a letter to the editor really shouldn't be more than a couple of pages. If I get a letter to the editor that's longer than that, I'll almost always send it back and just say, rewrite this, it's too long. The introduction should be 3 paragraphs. Doesn't have to be any longer than that. It should set the clinical problem or the background in the first paragraph. The second paragraph explains the deficit in the evidence. And the third paragraph establishes your aim or hypothesis. It's really simple. And when you read a paper, look at the next paper you read and see if it's structured appropriately. So a lot of people put a ton of citations or references in the introduction. It just is distracting to do so. Say if you need to reference a lot of things, those probably ought to be in your discussion. Maybe 1 or 2 references to set the clinical problem, perhaps, but really don't need much in the introduction. Long introductions lose readers. You want them to get to your study. This is the first mention of the word plagiarize, and we're going to talk a lot about plagiarism later on because it is rampant and it is a problem that will really kill you if you get into it. So the first rule is don't self-plagiarize by cutting and pasting techniques from earlier manuscripts. You can reference your technique if it's something that you've used over and over again. Just reference it back to the publication where you did it the first time, and let people get back to there. You don't need to detail standard surgical techniques. I don't need to read about how you did a Whipple. I assume you did a Whipple the same way that A.O. Whipple did a Whipple. If you do it a little bit differently, if it's a new technique, I do need to see what the new technique is, and illustrations are very helpful for a new technique. The statistical analysis, again, I can't stress enough engaging the statistician early at the study design phase. Maintain a very low threshold for adding the statistician to your author list. And when we get to authorship, you'll see what the necessary elements for authorship are. But a statistician really does get involved in study design, should get involved with looking at the manuscript, and should sign off on it. And those are the 3 elements of authorship. So there really is a role for a statistician as an author on many papers. if you're not going to involve them, at least involve them with a consultation for all but the simplest analysis. Having said that, I think anybody sitting down to write a paper sort of needs to know about parametric and non-parametric tests and when to use a chi-square and when to use a Fisher's exact. So you need to know a little bit about your basic statistics so that you're not completely lost. And it's helpful when you're a reviewer as well, because when you're a reviewer, you won't have the statistician at your elbow. You're going to have to kind of have a general idea of whether they applied the appropriate statistics. Again, if it gets very complex, then you need a statistician to help you with the review. If you want to do a review of a field, the state of the art is either the meta-analysis or the systematic review, and there's strict methodology that's associated with those. So don't just sit down with a bunch of articles and start writing. Go to the web, go to PubMed, and pull off some articles on how to write a meta-analysis, how to write a systematic review, because all that information is there for you. Results, again, you'll see this general theme here: avoid needless words, keep it short. We tend in America to be very wordy as writers, and I think we can really abbreviate what we say, use concise language. Do not repeat information in the tables and text. I've had some discussion with other journal editors over what the best way to display results are. I personally like graphics. I think graphics most rapidly tell you the information that you need to see. When you go to hear people's talks on whatever subject, they will have pulled the graph out of the article. They won't have pulled the table. They won't have pulled the results. The graph is convenient. The graph shows your story. And so if you can show it that way, do. Sometimes it's important to put a table with the graphics to give the raw data so that people can get back to the raw data. But so there may be permissible to use some redundancy between graphics and tables. But generally, the point is try not to bury all your results in text. And use standard graphics when they're available. Don't make up a new way of graphing something. So if you're looking at survival of cancer, use a Kaplan-Meier survival curve. Please put the number at risk in your curve. So many people leave the number at risk off. Randomized clinical trials, great things. Do have a way that you have to report them for journals. The first is that they be registered. Very easy to do at the NIH.gov, clintrials.gov registration site. And then the consort requirements. Again, how many people here have heard of the consort requirements? So about 30% have heard of the consort requirements. So if you ever write a randomized trial, if you're reviewing randomized trials, you should know what the consort requirements are. It was a consensus group of scientists and editors who came forward with about 22 points that should be reported in a randomized trial. The critical things that are most frequently omitted is the power analysis, which needs to be in your statistics. A consort flow chart. If you ever look at a randomized trial in the New England Journal, they'll have a flow chart in it. Make sure all those elements are there, and that's on the web. Just type in consort requirements, and you'll find the flow chart and the whole deal. The discussion usually can be cut by 50%, and almost always too long. Don't repeat your results. I just read them. I don't want to read them again. It's better to understate what you've done rather than to overstate it. Be humble. Include a paragraph on study limitations. I think that's really been pretty well drilled in now. Most things coming through have that. And sometimes I'll accept a paper that says further studies will be necessary. I really don't like that. I think it means you may not have succeeded in doing what you were set out to do. A couple more pearls. If you're writing your discussion, don't say in a previous work by Kent et al. It was shown that, because first of all, everybody here knows Kent. Some of them believe him, but do say in a previous work it was shown that, and then your citation will take you to Dr. Kent's work, and so it reads so much better, and it's just unnecessary. Ron Maltz says it sort of decreases your credibility as the expert when you cite some other expert. I'm not so sure about that. I like maintaining humility, but nonetheless, I think it is a valuable rule. A lot of papers finish up with a table summarizing the literature. was helpful for the author to put that table together to understand what had been written and what all the data were. It's really often a marginal value to the reader of the paper. All it shows is how many lousy studies there were that had been done before. So I usually leave those tables out when it's time to actually publish it. And lastly, and most importantly, figures, tables, references, and title. You can see I've left the title for last. Figures have a legend. They should tell the story of your study. So one figure, you could spend half the time that you're working just getting that figure right. Include a p-value on the figure. Photos, color will cost, although color is for free online, and since everybody's reading online now, use color if you're using photos. Line art, if you can afford it, is the best way to show a new operation. Again, it can be costly to produce it. Tables have a title, and Table 1 should be in all comparative studies showing the demographics of the groups. And, of course, tables must stand on their own. Statistical tests, abbreviations need to be footnoted. References, follow the journal site instructions, minimize self-citation, make sure they're current, make sure they're accurate. There are so many times references aren't accurate. And only use those that are important. Don't reference everything. And so title I left to the last, because I think title is probably the most important in many respects. It should be declarative, not too long. It should include the type of study in the title, so you can learn whether you want to read further. You're not going to say this was a really lousy study of, don't put that in the title, but case, cohort trial, randomized controlled trial. Include your study subjects if they're not human. So if it's an experimental study in rats or pigs, please put that in the title. Don't try to hide it somewhere so that the reader can't find it until later. Avoid questions. We don't want a question in the title. And avoid location. When I see an article on kidney transplantation in Madison, Wisconsin, I wonder why that might not be relative to Ann Arbor, Michigan, or Portland, Oregon. And so it should be generalizable to the audience that reads that journal. And if you're sending something to the World Journal of Surgery, I don't really care that much about Kathmandu. I really want to know something that's relevant to the whole world. Avoid cute titles, except for editorials. So this is going to get a little bit deeper and a little bit sort of more complex, that was the sort of straightforward stuff that I think needed to be covered for students and junior residents. But authorship requirements are difficult, and they're difficult for everyone. They're often, the more senior you get, the more responsibility you have for work, the more difficult determining what the authorship list should be, who should be an author. So I'm just going to start again at square one and say, okay, what do the SJEG is the Surgical Journal Editors Group, and it was a group that Bing chaired for about 10 years. And it was a group of journal editors that got together once a year to talk about issues, and there were a number of consensus guidelines that we developed. So to be included as an author, one must make substantial contributions to conception and design or acquisition of data, and or analysis and interpretation of the data. That's number one. Number two is you must participate in the drafting or revising of the article, critical for important intellectual content. And then number three is you must give your approval for submissions and to any revisions. Now, one of the challenges here is getting 5 authors to actually look at a revised manuscript. How do you do that? You give them a timeline. Send it out to them. I'm going to send this in 2 weeks. Could you take a look at it? And then a day before you're about to send it in, said, geez, I got to send it in now. I hope you had a chance to take a look at it. If not, please let me know. And most people will sign off on it that way. But you do have to send it back for the second sign-off. Now, how many authors is too many? I actually don't know. I have believed, and we've had a discussion amongst the associate editors of our journal, and we arrived at the number 6. Having arrived at the number 6, I don't think it's correct, really. But if you are going to have more than 6, we require that you explain exactly what everybody did, and many journals will ask for that explanation, regardless of how many authors there are. the acknowledgement section, nobody uses it enough. Use it liberally for all other contributors. Some journals, I just said that. University promotion committees and membership committees look primarily at whether you were the first author or whether you were the last author. And more, though, as we're trying to facilitate collaborative research, we, rather than publish a paper in the anesthesia journal and the surgery journal, which is duplicate publication, we urge that people take dual credit for first authorship, and an asterisk will indicate that shared first authorship is very acceptable. Now, there's something called gift authorship. And gift authorship is a very common practice, especially in Europe, where the chairman of the department will get his or her name tacked onto the end of every article. Most of those chairs have 600 papers to their names. And I was actually giving this talk in front of a bunch of European chairs recently, and they were sort of smirking to themselves. But the practice is beginning slowly to change in Europe. Luckily here it's not that common, and we generally put the senior lab mentor, the senior program mentor as the last individual. Don't add family members, close colleagues, the famous person in another department. And again, this is a sort of more common in papers coming out of Eastern Europe, where they have added, Dr. Kent or Dr. Turnipseed, and you say, now what's that name doing in the midst of these names? And I'll actually call or write you and say, did you know that these guys were doing that? So the problem is the recipient of the gift is in a very awkward position. They may have Craig may have mentored one of these people somewhere in the past, but has now lost track of them. And it's very difficult to say, hey, take me off the paper. But when your name is on the paper, you're responsible for all aspects of its content. So you really want your name off. So it's okay to be stingy with the author list. And not everybody has to be an author. So picking a journal for your baby is another hard question, often a lot of debate. And one of the things that I think is important to point out is that getting your authorship list straight, getting the journal that you're going to send it to straight is often really early, like a statistician. If you can get that done at the beginning so that there's no difficulty later, that's a really good idea. The impact factor, I know everybody in the room has heard of an impact factor. The calculation is not difficult. It's just the number of citations in a particular year in any index journal to articles published in a particular journal over the prior 2 years. So divided by the total number of articles. So if there are 1,500 citations in 2010 to 500 articles published in the World Journal or Annals in 2008 and 2009, that impact factor is 1,500 divided by 500, or an impact factor of 3. Now, more and more people are looking not at just the 2-year impact factor, but at 5-year impact factors as journals get greater. It is an indication of greater longevity of the article. And I think the 5-year is probably more valuable than the 2-year. So what do you make of all that? Well, it is important for promotion in some institutions, probably all, to be submitting to the best journals that you can. So if you're doing basic science, you probably don't want to put it in, I won't name a journal, but you don't want to put it in a throwaway journal. If you can put it in Science or Nature Medicine, that's where you want to put it. If you can't put it there, one level down are the best clinical journals, such as New England Journal or Gastro. And then the surgical journals are good. Certainly Annals has the highest impact factor. But everything below that level is pretty much equivalent in terms of how they will look at your publication. But citation frequency is just radically different in any journal. Probably a third of the articles in Annals will never get cited, no matter how good a journal it is. And half the articles in the World Journal of Surgery never get cited. But there are a few that get cited a lot. And so it's the citation frequency of your paper that's really important. And it probably doesn't really matter that much where you published it. Know your target journal. Again, pick a journal that publishes articles like yours. Check the table of contents. Make sure you read the instructions to authors. So many people don't. And when you flip your manuscript after that first rejection, please revise the cover letter. I don't edit the British Journal of Surgery. This one was one we recently got, talking about knowing your target journal. Use of chitosan and polypropylene in the surgical correction of penile deviation in bulls. And but not really right up our alley. I did send it out for review and got some very amusing reviews back. Needless to say, we did not publish this one, although I was tempted to. Copyright. When you sign the copyright form, this means the publishers own your words. Okay, that is the quid pro quo. They put a lot of money into getting your words in press, and they spend a lot of money on peer review, on editing, on production. So you give them your words for free. And it's really only when you get famous and start writing very large-selling textbooks that you actually can make some money with your words. One thing that I think all of us have done at some point in our career is get some very nice artwork done, send it off to Annals of Surgery. They own the artwork then, and every time you want to use it for the next 30 years of your life, you've got to get permission from Lippincott, Williams, and Wilkins to use your own artwork. So I suggest that you retain the copyright of your own artwork and just give it by permission to Williams, Wilkins, and Wilkin, whatever they are, to publish in their journal. So consider retaining the copyright of your art. Editorial misconduct. Editorial misconduct, again, is a big problem. We had a subgroup of the SJEG which proposed a taxonomy of editorial misconduct, including severe misconduct, and you can read what those would be. Moderate misconduct, sort of one level down, plagiarism of self, salami slicing, and then mild misconduct. And I would sort of argue that some of these things, like failure to disclose conflicts of interest, can be major issues and not mild issues. And we came up with some uniform sanctions that would be then used across all journals. The problem with that was that we fell amok of the lawyers who said that's sort of collusive behavior and you can't do it. So that actually just sort of fell apart. And so we don't really, as a group, have any uniform way of dealing with these issues. So every journal editor now is kind of left on their own to deal with it as they want. But I think there are some concepts that are uniform across journals. The first is that the theft of words, figures, or illustrations that do not belong to you is plagiarism and is really the primary editorial sin. For a long time, detection of plagiarism was up to the reviewer to say, I think I've seen something that looks something like this, and I think it was in the New England Journal, and then go back and find it. That, of course, is fraught with problems. These days, a computer program that can scan the world's literature and pick out phrases and groups of words that statistically would not appear together is state of the art, and most journals are now using it. So it's a probabilistic model. And this, the program that we use and many are using, is called Crosscheck. And this is an article that was published in one of our symposia recently. And the 32% of the article had been published before. And this blue article is where it was published, the Advanced Drug Delivery Reviews. 724 words, or 6%, had been published in a different one. Now, these were all things that the individual had already written himself. He wasn't stealing it from anybody else. He was just being lazy and not rewriting the review article. So this, you go down into the text, and you see the blue, the red, and the blue, and those are pieces that have been taken verbatim from another article. And so it's pretty easy looking at one of these things to determine whether this really is plagiarism. And you do have to look at every one of them. You can't just take the computer. It's like reading an EKG that the computer reads. You know, it gives you an idea, but it's going to be wrong a lot. So you got to go look at it yourself. And then we go back to the original article just to make sure and pull the original article. And then in this case, one of the people at Springer underlined all the words that were exactly the same just to sort of prove it once and for all. So the response to that is that we just send it back. If it's a self-plagiarism, I'll send it back saying, hey, you can't do this anymore. A lot of people don't know that, and so just rewrite it for us, especially if it's a review article, or pull it. Now, self-plagiarism is cutting and pasting of sentences or blocks of text. Again, please cite the previous work if the methodology is identical rather than importing the whole block. There's a copyright violation. And I guess some people say, well, can I just copy it and then reference it? No, it still is plagiarism because the copyright is owned by that first journal. Research fraud is another element of editorial misconduct. This is pretty obvious. I don't think I need to really even say much about it. Duplicate publication is a subtly different than self-plagiarism because, of course, there may not be, you might rewrite it, but it's still duplicate publication. So if you use the same article, no matter whether you rewrite it or not, the same data with different words, or same data with different authors, it's all duplicate publication. And the worst is when someone sends the same article to 2 journals simultaneously. And often it's just the good graces of a reviewer who's getting sent both of them because he or she is the expert in that area, and they get them simultaneously, or have just reviewed it, or it's just about to come out in another journal. So that really is really a problem. Now I'm going to talk a little bit about salami slicing, because salami slicing is something that is something that not everybody really knows about, but is really a issue, and again, is kind of a difficult one. Salami slicing is really defined as dividing a single study into multiple publications. Again, it's sort of like pornography. It's probably easier to say what it isn't than what it is, but it's best avoided when a manuscript extends an original database. So if you have 100 patients and you add 5 to them, don't report it again. If you have 100 patients, you add 50 to them, it's probably okay to re-report that experience. Or if it takes that original database and analyzes it in a completely separate way to prove or disprove a completely different hypothesis. So again, this is sometimes a little nuanced, but it is important. Again, it is open to interpretation. The arguments or debates I've gotten into with colleagues and with authors is that my study was too complex with too much data to present as a single study. Well, sometimes that's correct, but not very often. And then the question is, how frequently can you write a follow-up? If you've done a randomized trial, and you've reported 1-year results, can you report 2-year results? Can you report 3-year results? Can you report 4-year results? Well, when someone reads that paper with their 4-year results, they're probably going to get a little bit, their eyebrows are going to go up a little bit. So again, this is where a mentor is very important. From my perspective, I think 1-year results and then maybe 5-year results, because that's reasonable. But don't report the results every year. It gets unless they're substantially different. I mean, if all of a sudden things change and what you said before was wrong, that's absolutely okay just to say, this is what we learned. So how different must the hypotheses be? Again, a nuanced question. Again, put your whole study in a single manuscript if you can. On database expansion, check with a seasoned author. Always be willing to collapse 2 manuscripts into one. I've done that once. One article we had to study, had 2 sides to it. I sent it to 2 journal editors. They looked at it and said this ought to be 1 manuscript. We collapsed it into one. Cite original article and discuss the differences. And, it's not worth gambling your academic reputation for the sake of one publication. Just think about the stakes here, because your academic reputation does suffer if you're found sort of guilty of duplicate publication. Authorship issues. Again, this is not anything I, as a journal editor, care about. It's a local issue. How you list your authors here in a lab is up to you, and I can't police that. I'll often get letters from 2 different authors from the same institution saying, I should have been first. No, I should have been first. No, I didn't approve this. I just send it back to the chair to deal with it. It's not really my issue. But it does cause major rifts amongst colleagues, so it is important to get it done first. Failure to disclose conflicts of interest, more and more important. You've got to do it. Same is true of funding. And erroneous citation is editorial misconduct, and it's usually picked up by a bright peer reviewer. So make sure when you say that whatever finding you use, make sure that the citation that you cite actually said that and didn't say something different. So what about peer review? We're almost to the end here. Peer review is a difficult process. Less than 1% of manuscripts are accepted without revisions, so you'll always have a chance to redo your work. Follow the reviewer's questions point by point. Make sure you add your answer back in the manuscript. If you just answer it in the point by point but don't put it in the manuscript, it just doesn't do any good. Don't argue with the reviewers. You'll lose. When two reviewers ask for opposite things, which will often happen, point out to the editor which one you think was correct and then do what you think is right on that one, because the editors don't have time to really adjudicate the differences between two reviewers. So there are unreasonable requests, and if you get an unreasonable request from a reviewer, again, point it out, say why you can't do a whole new set of experiments, and you may get rejected because those new experiments might be vital to publication, but at least just point it out and say you can't do it. Now, more and more, the journals are getting backed up. When I took over this job, we had 400 manuscripts, original manuscripts a year. Now we have 1,800 original manuscripts a year, and we can publish 300 of them. And so it's not unusual for the whole system to get clogged up. I know a few of our big journals are way clogged up right now. It is okay to send the managing editor a single email, but don't do it 1 week after you've sent in your manuscript. Give them a little time. Rejected manuscripts almost always have a home. Please revise it after you get it back from rejection. Don't just flip it and send it into another journal, because the next reviewer is likely to be the same, that you just, again, for the reasons I've said before. And usually if you revise your limitations paragraph, that's probably the best place to go in and pick out the things that the other, while a randomized trial would be nice, it just was impossible in this setting. Don't let the data age. You must update it. The proofs, you'll get proofs back. So many people forget to actually, this monitor went down here. See if it comes back up again. Just touch it? Thank you very much. There we go. Thanks. Many people just jump right into the text to make sure that their writing was adequately copy edited without looking at the stuff at the top. And then when it goes online, they say, "Oh, you misspelled somebody's name." You'll never find that article associated with that person's name ever again once it's misspelled, because looking through a search engine, unless Google sometimes can pick up misspelling, but often with names it won't. So it can't be changed later. Copy editors are generally pretty good, but not always, and it's okay to restore your original language if they've changed something that you don't like. Good reviews. Start with a brief summary of the article, and then add your major comments, which should be first global about the article, then specific for each section, introduction, methods, results, etc. Minor comments are important, and these could be punctuation or spelling, although you don't really need to put that stuff in there because that's what the copy editor does. Review the tables and figures for clarity and consistency, and references for completeness, accuracy, and timeliness. And again, most people run out of gas before they get to the references, but you need to look at that. What about, we're all besieged now with tons of stuff to review, and how do you deal with that? I think I had a discussion with Becky yesterday about how often you should say no, and the answer is, in my mind, if you say no too much, you're not going to get asked again. Now, if it's a journal you don't care about, you then say no. But if it's a journal you do want to ultimately be on the editorial board, Annals of Surgery, for instance, you probably don't want to say no too much, or they'll stop asking you and you'll never be on the editorial board, because that's how you get there, is by doing good work. On the other hand, don't say yes and then be late. And Americans are the worst, and of Americans, the worst Americans are those that work in your own department. So, especially when you're the chair. So I try not to tap into too many people from my own department. Don't do superficial reviews. I can tell you how many times really crappy stuff has come back with accept on it because the person just got behind, got too lazy to actually review it, and just click the accept key and send it back. That's worthless. On the other hand, if the manuscript's trash, don't spend a lot of time with it. Just say this isn't going to cut it, and then just say reject. Usually with one sentence you can put the fundamental flaw out there. Mike Saar loves to be the copy editor. He'll go in and do detailed editing of manuscripts. It's wonderful to do that. It's really time-consuming. I don't think it's necessary to do that, so don't try to be the copy editor. Don't isolate your critique to the comments to the editor. Tell the authors what you think. I've actually taken the word confidential off the box that says comments to the editor, because those are usually the comments I like to use, and our editorial board said it's okay, but it's people are often too shy about telling the author what was wrong with their work. So anyway, that really brings me to the end. I'm just going to wind it up with just a few conclusions, really where we started. Why is it important? It's really the measure of academic prowess. Publication deficiency is a barrier to promotion. Many bright people leave academics because they just don't want to write or feel they can't write. It's not easy for anyone. You need an editor, and editorial misconduct, perceived or real, destroys reputation. So with that, I'd love to wind up and see if anybody has any questions about what we've done. Thank you very much for the opportunity to be here.